Mr. Takis KOTIS. He's going to present us the topic reducing hospital-acquired infection with artificial intelligence. Mr. Takis KOTIS graduated from the University of Minnesota Twin Cities with a bachelor degree in health economics and a master of business administration in health and care administration management. With over 40 years of experience in the healthcare industry, he specialized in transforming healthcare organizations through information and communication. Technology focusing on strategic management, business intelligence, and healthcare.
Thank you very much. Good morning, everybody. Thank you for the introduction, but also I would like to thank the Hellenic chapter for inviting me today, and also changing the schedule because I was supposed to talk tomorrow, but tomorrow I'm going to be somewhere between Greece and China, so I felt that it's a great honor for me to be here, but I feel a little bit uncomfortable because I have been in the healthcare industry for 45 years, but I have never made a presentation to civil or mechanical engineers. So this is my first attempt, and I would like at the end to see some ideas of how healthcare and your specialty can intervene. There are a lot of spaces that we can explore together, but let me give you a background of who I am and how I ended up in the Cambridge Biomedical Campus. So, yes, I did study at the University of Minnesota. I worked for the Mayo Clinic for 9 years. I moved to London. I worked for 19 years for the Royal Brompton Hospital, which is heart and lung specialized hospital. And then in 2007, I moved to Cambridge. And moving to Cambridge, we had a global view of how we can transform a university hospital into a global biomedical campus. So we started visiting different countries. The first country we visited was Japan. We worked with the Japanese for 8 years, and we looked upon many areas. The most important one was building new facilities for the elderly. And that was for us the first dip we took into the global arena, and to look on how the global health is going to be affected the next years. Of course, we didn't know what's going to happen in 2020. Our next country that we moved in was China. So we started going to China very often with the idea of exchanging ideas in healthcare, but also the most important thing of how can we tackle problems that face both countries. And today what I'm going to present to you is an area that I presented in 2010, 2013, when I was part of training the Greek hospital managers and make them aware of what is the hospital infection area, how most of the managers, usually the hospital administrators, they leave it aside, but somehow it's a very important area they should be looking at. And of course, one of the areas that I hinted on them was to see what is happening in their hospital when it comes to the theaters and also to the ICU. So what I'm going to present to you today is that experience, but also the change of the technology, putting artificial intelligence into our hospital management. So I'm going to start with one basic question that I would like to look upon, and look upon what is the healthcare associated infection area, and what are we talking about? We have to have a common definition of what is healthcare associated infection, and how do we monitor the infection in our hospitals. What resources and commitment it is required to have. And this is one area that we have been not doing so well when it comes to management. How do we feed back results? This is an area that we have been lagging back in healthcare, of what kind of data do we get from our different departments and how this data is going to be analyzed. How effective have our interventions been? And those are the areas that I believe that we should be looking at. And we should be looking, here we go. We should be looking at more carefully on when we're talking about a hospital setting and when we're looking about hospital infections. So I would like to give you a definition of what healthcare-associated infections is. Those are the infections acquired by the patients during the healthcare delivery. That's the simplest definition of what the hospital infections are. And what is the global impact on those infections? It affects 99% of inpatients worldwide, leading to increasing cost and, of course, mortality. And we have challenges. What are some of those challenges? Despite prevention efforts, this infection persists worldwide and necessitating innovative solutions. And in my presentation, you're going to be hearing quite a bit talking about innovative solutions. So let's look upon how can we, as infection control teams and hospital administrators, work together to make an effective and sustained impact on hospital-acquired infections. So, we're facing three big challenges. Number one, the resource constraints. Overloaded hospitals, high bed occupancy, and inconsistent infection practices. This is our number one and the most important challenge that we face. Also, we're facing behavioral challenges, poor health hygiene, and of course, to comply on those health hygiene rules. And of course, one of the major problems in smaller countries, it's the use of antibiotics. I cannot stress more this challenge of managing antibiotics in various smaller, especially countries. Then, the third one is monitoring gaps. We have limited quality indicators for tracking and improving infection control. In any hospital, in any country you go, from the United States all the way to the third countries, you are going to see variations on how we measure quality. We're talking about KPIs, we're talking about e-health, but you are not going to find a systematic way of monitoring the gaps. This is okay. So this is something that changed the whole healthcare system. 2020, we're facing with a new situation. Every healthcare system in the world is in crisis, and we learn about COVID-19. And also we learn about antimicrobial resistance. What is that? During that time, we had 32% rise in hospital-acquired resistant infections during this infection period. 6.3 overall increase in antimicrobial resistant infection, 10,000 hospitalizations from 101.9 to 193. That's, you can see the difference and you can see the impact that COVID-19. But those numbers have been remaining high even after the pandemic. How does that affect the community and also the hospital infections? You can see that 32% are the hospital infections affected, where the community-acquired infections is 1.4. This is what we hope is going to revolutionize the infection prevention using AI, artificial intelligence. We believe that AI drives improvements in real-time surveillance, risk-based infection control, and adherence to preventive protocols. AI models simulate infection scenarios, advocating proactive measures and curbing the overuse of antibiotics, which helps reduce antimicrobial resistance. So this is the subject that I would like to discuss today. How can we revolutionize the in-hospital infections by using technology? We believe that AI can transform the whole area of infection control. We believe that can detect risks. We can have real-time monitoring and predictive analytics for early intervention. Also, it can help us with automation, robotics for disinfection in high-risk areas, improving our hygiene compliance. And also, it can enhance our decision-making. AI-driven support for antibiotic management and infection prevention. So what are the benefits of the early detection with artificial intelligence? It enables rapid identification of outbreak risks by analyzing location-specific factors like patient conditions and care team dynamics. Early detection translates to cost savings, reduced hospital stays, and enhance patient outcomes. It also safeguards hospitals' reputation. And of course, when you look upon countries that they have paid a lot of attention with bringing patients from other countries, medical tourism as we call it, you are going to see about the area of the reputation. So, here we go. So let's look upon some challenges and also some ethical issues. The challenges are data privacy, high implementation costs, and also the training needs. The ethical concerns, transparency of AI algorithms, and patient-centered care. And this is the area that personally I have invested a lot. And you will see in my slides further on that centered care is where the whole industry is going to. Let's look upon what makes the difference. We believe that we have to improve clinical care, especially when it comes to invasive devices and to ensure the package, good antibiotic management and also practices, efficient commissioning and monitoring and services delivered, infection control teams that enable. That's the key word. The most difficult task that those teams face is to enable and pass the message to the whole hospital staff how important it is to have the infections under control. And of course, the partnership work. The partnership, how the different departments work together, how the cardiology, the ICU, the theaters work together in order to attack infections. So, looking at the future. So, this is where I think your specialty comes into place. We have to advance AI tools to personalize infection prevention, smarter, more efficient hospital environments. That's what I believe the future is lying ahead of us, and that's where your specialty can contribute a lot. and also a vision of safer, sustainable healthcare systems. And looking on personalized healthcare, we are going to be here different definitions. Personalized precision medicine, we are going to hear about personalized medicine. I like the term healthcare, precision healthcare. I think personalized healthcare is what we should be looking at, and what I demonstrated to you, that's how AI can assist us a lot. When we talk about personalized healthcare, what do we really mean? A tailored treatment based on individual patient profile. How do we do that? By analyzing the genetically and mostly the DNA profile. The applications. Most of the departments, when it comes to oncology, neurodisease, immunology, respiratory disease, and chronic diseases. Those are the areas of high importance of how the personalized healthcare can be applied to. What are the drivers for growth? The aging population, chronic diseases, diabetes, cancer, and also the advancements in pharmacogenomics. Let's look upon how the eye can play a role in personalized healthcare, and specifically when it comes to infection control. Precision targeting of infection-causing pathogens through molecular profiling. Predictive analytics to identify high-risk patients for tailored preventive measurements. Real-time monitoring to personalized treatment regimens based on patients' response. This is my conclusion. Healthcare-associated infections pose a significant global challenge. AI provides predictive, preventive, and sustainable solutions. Combining technology with robust infection control practices ensures safer healthcare. And personalized healthcare and AI create a path towards a safer, more efficient healthcare system. This is something that everybody, when we talk about hospital management, everybody knows. So let me give you a number that maybe we can get some of the global healthcare systems looking upon how serious our hospital infections are. So when we look on globally healthcare-associated infections, which represent a significant burden on the healthcare system, costing hospitals millions annually. In high-income countries, the cost of healthcare-associated infections can cost and exceeds the 40 billion per year. Those numbers, you don't hear about it. But when you manage a hospital and you're saying how my budget has been out of track, I think we should be looking upon those costs more carefully. And I'm going to finish very fast. September the 7th, 2013, it was announced in China by the President Xi Jinping about the One Belt, One Road. This is the old Silk Road. And this is what China sees as a big opportunity to influence, but also to participate in the growth of the countries, especially the ones that are underdeveloped. So we have one belt which covers the maritime, and we have the one road that covers the road from China all the way to Rotterdam, Holland. But I visited in 2017 a hospital, a very small hospital in China, and I saw this beautiful wall painting. In this wall painting, you can see the ancient Greek doctor treating or examining a child. On the bottom left, you see the traditional Chinese doctor. On the bottom right, you can see Western medicine. And in the middle, you can see Hippocrates' oath. And when I did see that, all of a sudden, the whole history of medicine came into my mind. And that's why immediately I called my secretary back in Cambridge and I said, we have to register the name One Health, One Road. And what is that? Is learning from each other, learning from what East has been doing for more than 4,000 years, learning from the ancient Greek practices. And combining that, how can we help our citizens better? And by doing so, here it's our first conference, and that's why I'm flying to China tomorrow, which is called One Health, One Road, and it takes place in the most prestigious city in China called Xi'an. And in Xi'an, we are going to present how we can work together in the field of health. So Chinese is called, Thais are called, Indians is called, whatever we call, let's work together. Why do we have to work together? So we can offer quality care to our citizens. Thank you very much.
Mr. Kotis. Mr. Kotis, wait. Do you have any questions?
Hello, Salim Nuruddin from Eurovet Certification. In fact, I have a small question for you who work approximately on the same target to reduce infection inside hospitals by creating hygienic air handling units. As you know, controlling the ventilation system is the most important and critical factor to reduce infection inside hospitals. Now today this is regulated in a lot of countries. There's regulation when we are talking about AI control. So we know that the ventilation rate and the pressure drop inside rooms will be controlled depending on AI. Now today, I do not see any government accepting to install a product that is controlled by AI and consider it safe. How do you see solutions for that in the future? Thank you.
Well, I think it's going to take a lot of education and a lot of talking to different governments to convince them. But I do believe that the facts are real, and what I presented to you today when it comes to AI assistance in our decision making, in our hospital decision making for better management, that's where I think all the governments are going to be looking at that more seriously. But as I said again, one of the challenges that we're going to face is to educate our staff first, our administration staff, because that's where everything starts from, and then to educate other specialists like yours how to get involved with us.
One more question.
Yes.
Hello, I'd like to ask you, do you have any data from Greek hospitals? Or let me put it a bit further. Have you asked for data?
Yes.
And have you received anything or not?
Yes. I did participate in an effort 2015 to start a program between Cambridge and the Attikon Nosocomium in Athens. And Professor Petrikos was the in-charge professor of that department. My experience has been yet that we are far down the road in order to recognize that the Greek management has to benefit from it, but it's not the issue economic, it's social issue. And a lot of things in Greece, they take into consideration the economic factor. We're talking about the human factor here. And from my experience, we need a lot of work to do in Greece, and a lot of convincing in order to get to the point of reducing those numbers. First, we have to identify the numbers. You don't get a real picture of the numbers. I have tried to do that.
Thank you. Short answers, please. One last question.
One last one. Thank you, Takis. That's fascinating. I'm a clinical doctor myself, an ER doctor, so I'm fascinated by this. So it's kind of two questions. Why has it taken so long for something that makes such clear sense, that kind of whole of patient thinking, East and Western medicine? And then what do you anticipate the obstacles will be, like vested interests, and what will the battle be to make this one road, one health objective work?
the industry, mostly the pharmaceutical industry, they have to understand that this effort is a combined effort. We are not in two different areas. We work together. So, and why I said that? Because the pharmaceutical industry drives a lot of innovation, drives a lot of funding into different things we're doing in healthcare. So, in my effort for the last 5 years, it has been to approach the pharmaceutical industry from everybody's going to win. It's a win-win situation. So hopefully when we bring new technology from China or from East, India, Sri Lanka, Thailand, everybody's going to benefit. So first we have to work together and we have to convince the industry that we are not competitors, but rather we are working together. Yes.
Yeah, Dennis, thank you, Takis. Wonderful presentation. Just a couple of comments. First, from the AI perspective and talking about governments, I think the cat's out of the bag. I don't think the governments will have a thing to do with it. Our young engineers, our young doctors, our medical professions, our pharmaceuticals, they're going to use it. And they're going to use it to increase market share, to reduce risk. So that train has left the station. The other thing that I would encourage you, and I'd love to work with you from a collaboration standpoint, we've had for decades what's called the Environmental Health Committee within ASHRAE. We publish a standard called Standard 170 that is the ventilation standard for nearly every hospital on the planet. We just created an ASHRAE Standard 241 that came out of us working with the White House during the COVID pandemic. Standard 241 is the mitigation of the transmission of infectious diseases through mitigating it through air cleaning and ventilation. And we just all need to be collaborating. We need to be all on the same page and providing ideas to each other. Our ventilation standard would get better by interacting with you, and I think your practices would get better by interacting with us and understanding the roles each of us play in improving healthcare.
Thank you. I want to make one point before I go. One of our biggest obstacles in healthcare is sharing information. I do hope that this One Health initiative will encourage people. If we have data, we can improve things. If we don't have data, we are going to keep doing things the same way. And no, I'm not satisfied for the services we offer to our citizens. That's my effort. I want to offer better services to our third age population, which all the countries around the world is facing with. I do want to be prepared for another crisis like the COVID, and I want to prepare the hospitals, not to react, but rather than to be proactive and get prepared for it. Thank you.
Thank you. And Takis, you know, one health, one road leads to Greece. We hope we'll have something for you in the future. Thank you.
Hopefully the course I will.